So, good evening, and thank you for joining the Anti-Racism Commitment Coalition for another Community in Action discussion. For those of you who are new to this CIA event, ARC is a coalition of dedicated people committed to eradicating racism and spreading anti-racism throughout our communities, countries, and the world. Through our online resources, podcasts, and events like tonight's Community in Action discussion, we hope to learn and grow together as we do the continuous work of transforming into anti-racists. I wish to remind everyone that tonight's discussion will be recorded and posted onto our website as a resource for other ARC members. Tonight, we will be educating everyone about some specific historical racist practices and open up the discussion to how this ties into our current medical system with our special guest, Carlton Allen. We hope you will leave the session with a better understanding of how the scientific method was not immune from racism and be engaged to explore this topic further. We're going to get started, and before we start, I just want to let people know that my background is not in the medical field. I am an environmental scientist, but this topic was something that I have been really interested in, and I had raised my hand to cover this topic. So please know that I'm not an expert. I'm just interested in this. And like many of you, I'm hoping that you'll be engaged to study further and learn more about this history of racism within the medical practice. I'm going to share my screen because I do have slides, and I apologize for people who maybe don't want to have a PowerPoint presentation, but yeah, that's just kind of how I am. So bear with me here. See if this works. Share. I just want to confirm, can people see my slide okay?
Yes.
Okay, sorry. Thank you, Adrian. So why are so tonight's topic, we're going to be focusing on why are health outcomes for Black people demonstrably worse than white people? Where did Black people's distrust of doctors and medical institutions come from? And why is the percentage of Black people in the medical and healthcare field so low? So for all of these questions, the answer is racism. And tonight's discussion is really only going to cover the tip of the iceberg on the racist history of the medical practices in the US. And nonetheless, it'll help explain how we've reached this point in 2021 where we're still having issues with worse health outcomes for Black people, especially in the United States. Add two more people, apologize. So the reference material that I'm going to be using for my initial portion at the beginning here is Medical Apartheid, and it's written by Harriet A. Washington, who was a fellow in ethics at Harvard Medical School and a senior research scholar at the National Center for Bioethics at Tuskegee University. This book is widely available, so if you're interested, you can feel free to check it out at your local library or order it online or in a local bookstore. So why are health outcomes worse for Black people? So medicine during chattel slavery provided pseudoscience to justify the lie of white supremacy and the treatment of Black people. So directly from the book, the belief in the eternal malingering of slaves was only one tenet of scientific racism, a wide body of mostly unflattering beliefs about the bodies and minds of people of African descent. These beliefs were presented as research findings explained by scientific theories and promulgated by whites who were sympathetic to or were actively profiting from the institution of enslavement. So not surprisingly, scientific racism provided medical and scientific justification for slavery. So what we're calling science is really just people believing and wanting to come up with a reason or justification to say that slavery was okay. And one of the ways that they one of the pseudoscientific methods that they used to explain this was called polygenism, which is the belief that Black people were actually a separate species from white people. And one of the things that came out of that was that scientists would claim that because they were a separate species, that their nervous systems were more primitive, so they were immune to physical and emotional pain and to mental illness, which would be used to justify the treatment of the slaves, and the treatment of, which would be used to justify their whipping and maiming and some of the more horrific things that were done to them. So from using pseudoscience to explain why Black people were apparently falsely separate species, some of the outcomes was that doctors and medical doctors would use these scientific findings as reasons for providing them clinical material in their own studies. So from the book directly, it talks about how physicians were dependent upon slavery from economic security, but also for enslaved clinical material to feed their medical research and medical training that bolstered physicians' professional advancement. So when a slave was taken to a doctor, it wasn't for their own health. It was really to allow the doctors in the medical profession to basically use them as test subjects and to perfect their own studies when it came to their profession and their skill set. So although medicine was essential to enslavement, this apparent solicitude for the health of slaves was not all it seemed. Rather, medical interests of the slave were often diametrically opposed to the interests of their owner and of American physicians. So from the very beginning, antagonism has always reigned between African Americans and their physicians. The other the other preliminary issue was dealing with slavery and with doctors is that the enslaver was the doctor's patient, not the slave. There was no autonomy. The slave had no say in any sort of medical work or procedures that were done to them. Specifically, the planter was the patient. The slave was unconsulted, uninformed, and had no recourse for any injury or practice that was done to them. So from this history, we see that from the very beginning that Black people were assumed different. They were assumed that they were separate from white people. They were used as test subjects, and since they were considered less than, that was justifying their treatment by medical doctors to use them for their own benefits and practices. So this is not past history, and these false beliefs are still perpetrated to this day. I pulled these slides. These are screenshots from somebody who I follow on Twitter, and I know that this is not scientific research, but this is somebody's sister who was training to be a midwife. This is from this July, and the person who was sort of her mentor told her that Black skin is thicker, so she may have to press harder with taking blood with a needle, which is false. So just to let people know, Black skin is not thicker than white people's skin. So you should not be pressing harder with a needle when you're taking blood of a Black person. But somehow this is a false belief that either their skin's thicker or they have less pain, so therefore you should press harder. And then this other one was somebody replying to that. Apologies for the language, I didn't cut that part out. But this was somebody following up on that, that somebody told them that Black skin is thicker, so they shouldn't have to worry about hurting their medical patients. And what's funny, not funny, but somebody else had mentioned that they just use a higher gauge needle for Black patients because they just assumed that this sort of idea that Black skin is thicker than white skin is true when it isn't. So these false ideas and pseudoscience is somehow today still prevalent in our medical field, which should be shocking to a lot of you. I mean, it was shocking to me when I had seen that from this year. So we talked a little bit, I had mentioned in the previous slide about sort of the distrust and sort of the history of this. So what's interesting is that the big lie of racism is the fact that it's a lie is easily proved, because in the previous slide, I talked about how they said that Black people, they had used their science to prove that they were less than, or that they were different species. However, they would use Black people when they would do test subjects to perfect white medicine. So we've already seen that clinics would use Black people for these different, they would actually use Black people in test subjects. And then once they perfected it, so all the dangerous studies were done on Black humans. And then once it was perfected, then they would use that perfected technique to be used to treat white people. So some examples were Thomas Jefferson. Yes, that Thomas Jefferson, he actually would test his slaves with by injecting them with smallpox. And in the book, it talks about how he was trying to figure out how to do smallpox vaccination. So he would he would inject a lot of his slaves, and then he spent the summer basically confirming that based on his the reactions of his enslaved population. Once it was proven that they didn't catch smallpox, then he infected his white family with the smallpox vaccine to help protect them. So what he ended up doing, it says, is that the vaccinated persons remained well and the unvaccinated ones fell ill, but this did not convince Jefferson's scientific peers. So Thomas Jefferson had a vaccinated slave injected with live smallpox material. And when this slave remained well, then he wrote to his daughter to say that now it's okay to basically use the same procedure on our family and friends in the sake of security. So actively injecting live smallpox into his enslaved humans to demonstrate that it was okay. One of the other people, the father of modern gynecology, James Marion Sims. So a lot of the practices that are still done today on for women when it comes to gynecology, this person, so he, sorry, this is a really hard thing to talk about. So he actually basically took 11 enslaved women and basically held them captive and just basically tested this procedure on them without their consent, without any type of anesthesia, because like previously mentioned, their science said that Black people didn't feel pain, therefore they didn't need anesthesia. And so he perfected this surgery. And then once he had perfected it on these women, then it was, he became this sort of famous, renowned surgeon for this procedure. And then it was done on white women. And of course, the white women in the practice were allowed to be anesthetized and, have the full, what you should do when you're doing a procedure on somebody. And the one of the quotes in here that I just want to bring up on James Marion Sims is that the ethical concept of social justice and these experiments violated the essential value because the suffering and the benefits have been distributed in an unfair way, leading to distributive injustice. In this case, the most powerless group, which is also a racially distinct group and a captive group, is the group upon which doctors inflicted harm for the greater good. Another privileged group enjoys the benefits, but shares neither the pain nor the risks. Thus, the moral unacceptability is clear. And what's interesting about these studies is the fact that earlier they were saying that Black people were somehow different than white people, yet they have no problem using Black people to perfect these studies and then use it on white people. So somehow we're different, but also it also applies to white people. So it just proves that their racism, their belief was false to begin with. And the last study that I want to bring up and just sort of summarize is the Tuskegee syphilis study, which I don't even know how to describe what this study was. I'm sure many people have heard of this before, but if you haven't, so the Tuskegee experiment was started in 1933, and it was not even an experiment, really. Sorry, I'm just going to pull it up in the book so I can share it with you. So what was done was that in 1933, they promised free medical care to 600 sick and desperately poor sharecroppers in Macon County, Alabama. And they explained that they were going to treat the people, and it was to study the progression of syphilis in Black men. But what actually happened was that they lied to the people, the Black men that they were had cited for the study, and basically withheld the treatment from them, and then charted the progression of the symptoms and the disorders. So they were not being treated, they were lied to, and then they were just being studied. And then when the men died, the physicians were going to autopsy them to determine and trace how the disease affects the human body. So what's horrific about this study is that they lied from the very beginning to these people who were thinking they were getting treated, but they weren't. But not only that, from the very beginning, the doctors weren't planning on, the whole point was for these cases to be autopsied. So basically, a quote from the senior officer of the program said, quote, "As I see it, we have no further interest in these patients until they die." So the whole point of the study was to just let them die of syphilis and then autopsy them to see what the outcomes were. And these are, just to remind you, these people did not know that that was the case. And this went on for, this is from 1933, it went on for 40 years. And what's horrific about this and why it's so disturbing is that these men were monitored throughout their whole lives, and they received no treatment. Like they intentionally, the doctors who worked on the study intentionally did not allow them to get treated. It said that here in 1941, the doctors circulated a list of the subjects' names to the draft board and instructed the military physicians in World War II not to treat any men who were inducted. So people who were inducted into military service their names were given to the military board so that they were not going to receive any treatment for syphilis. A lot of them weren't even drafted because their names were removed from the draft so that they wouldn't get treatment in the military. There were some, and just to clarify too, that syphilis was something, they came up with a treatment for it and a cure. So during this study, why they felt the need to continue to prevent these people from getting treatment for it when we already had a cure for it, it's just sadistic to think that they were intentionally preventing these people from getting treatment for this. But yeah, throughout their whole lives, they were prevented from getting any kind of treatment, like actively denied. Even when they go to a doctor's, even when they go to a treatment clinic, their names were listed and provided. And so even when they go to a treatment clinic, they weren't provided the treatment they needed to cure their syphilis. So it's to think that you're going to a doctor seeking help and they're intentionally lying to you and preventing you from getting treatment. It's just this is why this name Tuskegee, unfortunately, because the Tuskegee Institute is actually a really was a well-known medical institution, but this study just sort of tainted that name. So now when you think of Tuskegee, that's the first thing that comes to mind in many people's minds. So by 1969, 100 of the men who were in that study had died. And it wasn't until 1972 when a journalist actually broke the story, and it was published that year, when people started actually, I don't want to say caring about it, but once actual investigations were done, and it was shut down. So I'm going to stop sharing my screen because I feel like I've been talking to my screen the whole time, and I'm not actually seeing people. So that was just some of the highlights, not even highlights. I don't want to say highlights. That was just a small sampling of the history of the medical field. There's a lot more horrific things in this book. I will admit it's a hard read. I had to stop frequently while I was reading it because there's so much history that's just awful. But I want everybody at least to take away from this this little opening is that it's built into the system. It's going to take a lot of work to undo a lot of the damage, and there's things that we can do, which we'll talk about after I give Carlton a chance to share his thoughts. And we'll turn it over to Carlton, but I want to introduce him. So Carlton Allen is a licensed vocational nurse in California. He's a candidate for president of the Service Employees International Union, Local 521, and he's currently working to promote a diversity, equity, and inclusion plan in their healthcare organization. So I wanted to give him some opportunity to talk about not the racism on Black people's patients, but what it's like in the medical practice. So I'll turn it over to you, Carlton. Or Sean.
Thank you, Jenny. Yeah. Sean is, my family all calls me Sean. So just to go a little bit further, I've been a LVN for going on 26 years. I've worked 1,000 jobs. I currently live in Santa Clara County. I have been working for Santa Clara County going on 18 years. I actually started, and I came from a place, I grew up in Florida. My family, we're a really close-knit family. We don't get to see each other as much as we want to, but we're really close-knit. I grew up in Jacksonville. One of the experiences growing up in Jacksonville, Florida was a very racist city. I had to fight from the time I was a kid to stay in honors programs and gifted programs, and being accused of cheating on tests because I didn't write down things. I did everything in my head. Then to come to California, and when I first came to California when I was 10 years old, I remember writing my friend, and I thought California, Palo Alto was Mayberry. People were sitting and doing actual picnics. Like a picnic to me was a barbecue. So I come to California and there's Orthodox Jews with the curls and the hats, and they're walking down the street on a Sunday afternoon. And it's like, it's amazing. It was like this amazing thing. And then I came here and as an adult and entered into the medical system and started out at the county jail. I worked there for about 12 years and started realizing Santa Clara isn't what I thought it was. We are the second or third largest healthcare system in the world. I mean, in the United States. We have more beds than Los Angeles, believe it or not. We are the 5th largest economy in the world. And if you really just take that into consideration, the 5th largest economy, that is eclipsing that. We're in par with the United States. There's countries that don't have as much money as we do coming through the Bay Area. For as much as we are, I consider us the most progressive, regressive county in the world. I like to use the objective of If you're sitting in a boat and you're in shallow water, or you're looking in the water about 5 feet down, it's really clear, you can see. And down in Key West, if you go down, ever get a chance to go down to Key West, the water is really clear, but the deeper you go, it gets darker. That's the way our system is. It's very white at the top. There's a few Latinos spread around the healthcare system and powerful positions. But you start going deeper, the darker it gets. As you go down in your job classifications, when you get to the janitorial, there's a whole bunch of Black people and Latinos, but there's not, I don't think we have one white janitor in our whole healthcare system. I actually know there's not. So after George Floyd, that hit me to a point where I said I had seen enough. I'm tired of explaining to my sons. I'm tired of having to teach my son how to survive an incident, and watching our healthcare system be so bigoted and racist towards African Americans. I spoke to my cousin Donnie, or Donzel, I should say, and he said, you got to get the numbers, you got to get the information, you got to have this so that you can actually take and have the knowledge, so that when you're speaking and you're taking this to them, that they have to listen to you. And so I went to the CEO and I lost it in a meeting. As I was introduced, I am a chief steward in my union. I've negotiated 2 contracts. I've increased LVN's pay by 36% since I've done this. And that's a personal thing that I take pride in. I fight for workers. I don't get paid for the fights that I do. I do it because I care, and that for so long I didn't have a voice. I felt I didn't have a voice, but then I found it. And so then I started looking at our numbers. African Americans in our county, we only have, out of 3 million people in Santa Clara County, there's only 66,000 Black people. That brings us down to about, I think we're at 2 point something or 3% African Americans. If you look at our infant mortality rate, we're at, the overall infant mortality rate in Santa Clara County is 3.4%. And mind you, remember what I said, we are the 5th largest economy. African American mortality rate, our babies die at 6.1%. How is that possible? So we start digging, and then the Santa Clara County, all of a sudden, they tighten up. They don't want to give us any information because they're afraid of what the public looks at. And so we started this. I was all overwhelmed and overjoyed that we're going to start a diversity, equity, and inclusion office. We have 2 doctors that are amazing. One's a gynecologist, the other is a pediatrician. Very amazing doctors. They're saying, we need time. We need time. We can't run a clinic and then do this important work of diversity, equity, and inclusion for this healthcare system to improve the lives of our children and our babies, not just African American. We have a huge Latino population. It's 32%. They're the largest single population. But they said, oh yeah, you can have 50% of your time and you guys can work on it. But you got to figure it out. And you still got to do your full clinics. And if you guys know, anybody knows anything about doctors, they have to carry approximately at least 1,000 patients. How are you supposed to see your patients, care for your patients, and then also do a full-time job? So these 2 doctors got frustrated and quit. They said they're not supporting us. They're not giving us the time. They'll do everything they want to do in any other way and support every other project. But when it comes to diversity, we're not going to get it. We're not going to give you the funding. We're not going to give you the money. And they quit the diversity, equity, and inclusion group. It was a sad day. And we butted heads about the direction of the project. And mind you, this was 2 years ago. So then we still have a small group of people. We finally get the county to bring up a diversity, equity, inclusion chief operating officer, and the executive over the hospital, not the CEO. We have all this bureaucracy that's built up above us. So the executive that's over the hospital, health and hospital system and behavioral sciences and stuff says, well, we're going to wait on that to try to align with the rest of the county. We don't need that position just yet. We're going to wait. Meanwhile, what are we doing? So can we have funding? No, well, we'll figure it out. You guys go ahead. Hey, so the one thing they have done is allowed me to do 50% of my day as an LVN. I work in the operating room. I get people ready for surgery. Then the rest of the day, I can go and sit in the office and develop a training. Mind you, this is 2 years. 50% of my day as an LVN, I start at 5:30 in the morning. I get off at 2 p.m. But this is important work. The CEO of the hospital says this is important work. And I truly believe he has the best intentions, but there's bureaucracy ahead of him that won't allow him to do it. Why don't we have a chief diversity officer? Well, the person that's in charge, Santa Clara County basically said racism is a human, his exact words, was a human, God, I forgot exactly what he said. I was so upset that day. A human construct. He said it was a human construct. And if anybody knows me, that I lost it. I literally had to recollect myself. I had to get off the Zoom meeting. I had to not tell this man what I thought of him. I got back on and I told him, the last I checked, you're Latino, right? When me and you walk down the street, if there's a Latino and Black guy by the police, the police are looking for a Latino and Black guy, they stopping us. They don't know that you're the county executive, and you haven't faced racism in your life. And he says, well, Carlton, you'll figure it out. We'll keep going. We're going to keep going, and we're going to plug away. So where we're at right now is, and I promised myself and my sons that I'm not going to quit until I retire. I'm not going to allow these people and these small challenges because they're afraid to rock the boat. And I was just telling Jenny that it's exactly what Martin Luther King said. It's not the white supremacists, it's the moderates that are our problem. I am sitting in a county that is full of moderates. Actually, we're supposed to be one of the most progressive counties in the world. I don't know if you guys know, this is something else about Santa Clara County. If you're a Republican, you are not getting elected in Santa Clara County. Period, point blank. People ain't even listening to you. There's Republicans here, but they don't get elected in this county. But when you start talking to them and you start asking questions and you say, we had the Board of Supervisors gave a directive to look at the health outcomes of all people, especially African Americans and Latinos in Santa Clara County. And trust me, my family is multiracial. My girlfriend is Mexican. My cousin is white. I have Black cousin, white cousin, Asian. We got everything in my family. The lady they hired to lead the project manager is a white lady. I love her to death. She's a really good woman. She has zero history in diversity, equity, inclusion. The first book she read was a year ago, and it was White Fragility. But she's the head of a group that is supposed to address health inequities. And when I talk to her sometimes, she's just like, well, that's not the exact direction we want to go in. So eventually, where we finally got to is we have a 3-hour training, and this is huge. I'm upset about it because it actually, to really do an in-person training that is actually going to be meaningful, you need 2 8-hour days just to budge somebody's opinion of something, and just to set a pathway. So we have a 3-hour training on implicit bias. So it gets better. This is where it gets better. And this is the challenges, but I'm still positive that I'm going to leave a change in this county. I am the only certified LGBTQ trainer in the whole healthcare system. And if you would have known me coming from Florida, Jacksonville, Florida, I was probably one of the most homophobic people that you could ever imagine coming to California. That has changed. My thought processes, where I thought about it and the way I looked at it is, how can I ask for fairness and justice when I'm not giving it to everybody? And if I can't give it to everybody and I can't look through it as that lens, what am I doing? And in my county, so we have a large transgender population. You cannot believe how many people has come up and said, oh, that's a girly boy, or that's a he, she. And I look at him and I said, that her name is, or his name is. That is degrading to that people. That's why you'll see under my name, it says he, him, his, because that is how we start creating equity. So it's still challenges in the healthcare system. We still have doctors, attending physicians telling doctors, Black doctors, that they're defensive, that they're aggressive. And I don't know how you can be defensive and aggressive at the same time, but we have attending physicians that actually write this on their residents' evaluations. We have doctors still to this day that are saying that Black people don't need as much pain medicine. Me and a doctor recently had some words about it, because it's just the amazing things that you'll hear. And this is in 2021, that these still exist. You have physicians that truly believe that African Americans don't feel pain the same way as somebody else does. And you ask them to their face, how do you believe that? What in your thought process makes you believe that? And it really comes down to that they weren't taught. They were just given the basics of it. So the challenges are still there. All I can say is, if you're in a healthcare position or in the healthcare field, you have to get buy-in from the leadership, and you got to be willing to challenge them, and you got to willing to be put it on the line. I'm just in a unique position where I've had a mentor and people that brought me to the place where I can say things to people behind closed doors, but in public. And then also the threat of me bringing this out in public, because that's the biggest thing the healthcare system, a public healthcare system, does not want, is embarrassment in the news. They hate it. They're scared of it. So they entertain me, but I'm slowly getting what I want. This 3-hour training on implicit bias, structural racism, and introduction to SOGI training. And SOGI stands for sexual orientation and gender identity and expression. Is a big step for this county. So I'm gonna end there. And any questions?
Thank you, Sean. Yeah, so now I'm just going to highlight some of the things that Sean had mentioned, and also some of the things that we can do as a community to act and to do more than just learn about it, but how can we actually start changing the system? So one of the first things, obviously, do your own research, share that information within your networks, calling out lies or generalizations when you hear them, either on social media or in social situations, whether it's if you're actually in, if you're with your doctor or with your friends and you're hearing comments like that, call them out. Oh, great, Sonia's joined us. I'm going to wrap up this sort of community action list, and then I'm also wanted to give Sonia a chance to speak. Sonia is also a registered nurse, and I wanted to give her a chance to share some of her thoughts as well. But some other things we can do, mentorship. So in order to get more diversity in the medical profession, and it's not just doctors, it's technicians, it's nurses, we need to have more mentorship for students and more promoting, encouraging students to go into these fields and helping them have the resources they need, which can include donating to college funds to actually specifically for Black students to help them get a college education in the medical profession if they want to. Also, like Sean had mentioned, challenging systems, writing op-eds, getting publicity when you on certain topics, making it become more public. And I don't want to say shaming people into doing what's right, but sometimes the only way people actually change is if they get bad publicity, and then they're forced to account for it. And then I guess the last thing that I had wanted to highlight too is there's this, it's called Smarty Pants, and it's a Black woman owned business, and they have STEM clothing. I'm actually wearing one of her shirts right now. It says "Y'all need science." But she has a lot of cool STEM based clothing, and portions of her proceeds actually go to funding scholarships for Black women who are interested in the STEM field. So that's a fun way to maybe buy something for the holidays for somebody, and then also supporting Black students as well. I want to open it up. I'm going to stop sharing my screen again. And I wanted to give Sonia a chance to talk, since I saw that she had just joined. Sonia, are you there?
Yes, I am. Can you hear me?
Yes, we can.
Hi.
Hi.
So I just finished reading my policy on social media and such. So that's why I have a blurred background and you don't see the logo on my uniform. I'm actually at work. And so I've survived the past 30 years as a nurse and a respiratory therapist. And even though I work in the San Francisco Bay Area, and there is a significant minority population, most of the nurses and allied health professionals tend to either be white or of Pacific Islander descent. Nurses in the San Francisco area tend to be Filipino. I've experienced a lot of discrimination and in terms of hiring, even though I'm highly educated and have certifications in a lot of fields and can verbally and communicate well orally and written. And I have an MBA. I will tell you that it is very difficult to actually find people, Black women or non-white people in management. As far as mentoring other minorities into the allied health field, nursing in particular, it's actually been quite difficult. What people don't understand is that nurses have to meet the expectation of the client. Everyone has a strange idea of what a nurse is or what they should be: all caring, all available, all mother, all everything. But the employer has a different point of view. You are supposed to be all of that and be able to work computers, meet time deadlines, meet all sorts of other obligations. And so while the communities that we serve may think that nurses are all about bedpans and hugs, my job is so much more than that. I will tell you that even as recently as Friday, I've actually had to defend myself from, let's say, racial stereotyping. And it's disheartening, but I do it. And I will also say that, do I see other nurses here? It's only been in the past 5 years that I wasn't the one of 3 Black nurses in a hospital that has over, I'd say 1,000 nurses. There were 3 at our campus. And we have 1 Black officer in upper management that I have seen. So the need, the medical disparity is the only other thing I'll touch on. The way that my colleagues communicate to minorities has a lot to do with how they present themselves. I, as a patient, have had difficulty actually getting pain medicine when I literally say, I don't want morphine, I don't want Dilaudid, just give me my migraine medicine. And I've seen it where where people are actually pushing pain medicines on Caucasian individuals. So what I'll say is that the disparate treatment of minorities exist. It's not something that's talked about. There's a reason why that minorities prefer not to go to the hospital until it's absolutely necessary. And so it's something to be aware of. And I will say that it's even going to be harder now to get minorities to come into the field because of the stigma of COVID. There was a stigma before that. It was H1N1. Before that, bird flu. Before that, we had HIV, you know, and so there's always going to be something that people can point to about why not to go into the nursing field. It's a hard job. It's physical, it's mental, and it's unending. But we need more minorities in the system. That's all I want to say.
Thank you, Sonia.
Hello.
Oh, go ahead.
Any questions?
I just want to thank Sonia and Sean. I just put it in the chat. I mean, between them, they have almost 60 years of experience as medical professionals, healthcare professionals. So when they're speaking from real experience. This isn't some two people that have only been in the field for 10 years, you know, or just you know, worked in one area. I mean, they've had depth of experience, highly educated folks, and they can tell you stories of seeing inequality, inequities, and disparities, not only of African-American or Black doctors, nurses, but of the treatment that the patients are receiving from when they started to the midpoint of their careers, and they're still dealing and seeing with that now. So, you know, I just think we're very fortunate to hear from them and to hear specifically. And like Sean said, hospitals don't want people to know about this. Doctors want to be held on a pedestal. You know, I try to tell my family all the time, I mean, doctors are people. They're not superheroes. They're not someone that we should just bow down to. I'm going to challenge doctors because just like, to me, a doctor is a mechanic for your body. It's like a car mechanic is for your car. Why would I give the doctor more respect than a car mechanic? A doctor can be a racist. They've proven it. Janie went through many of those instances. We have to challenge those in healthcare because they can be ignorant as well. You can memorize a book and have no common sense. And so I just think that what I'm hearing from Sonia and Sean just reiterates to me when Sean told me he's asked to build a DEI program at one of the biggest hospital systems in the country. And he's got 50% of his job as the union steward to do that. And they don't have a department, a director, anything to put to this. That sounds like, let me do what I can to just make this go away. So it's going to take us to do what Sean and Sonia are doing tonight, which is standing up, speaking out, taking action, trying to make change in the face where it's very difficult. So I just wanted to say that and say how proud I am of them. They are my cousins. I am very proud that they spoke tonight, but I feel very disheartened that they have to deal with some of the things they have to deal with on a regular basis.
Yeah, I did also want to reiterate Donzel's. I really want to thank both Sonia and Sean for speaking up and volunteering to speak. And I really appreciate hearing your perspectives and learning from what you've seen in your careers and how we can help make this issue become more prevalent, that we can actually fix it. And I will say, as far as the maternal mortality, it is being looked at more robustly. And I wanted to highlight one positive was that today was the first Maternal Health Day of Action. Vice President Kamala Harris initiated a seminar today in the White House, and it was talking about these issues specifically and how they're working to address it and actually funding programs. And she got, I'm trying to remember, it was over $100 million from both private and public institutions to help funding studies and to actually help address this issue. So I will say that these certain things are starting to move forward, and we can see, I guess, positives where we can get them, I guess.
You have to take things as they come. You have to take the small victories, because the average time to change anything, just to incrementally change, is 10 years. 10 years. So if you look at it, I'm in year 2. And we did an analysis, we did a root cause analysis of our healthcare system, and we're symbolic. We look good on the outside, we ain't good on the inside. But what I just want to tap on one other thing. The one thing I can tell everybody on this phone, I don't care, is this has to do all with your healthcare. The most valuable thing you have is your human body. I interviewed my doctor. The first meeting I had with my doctor, I had an interview. I ain't here to talk about me, I'm here to talk about you. The first question I asked was, what is your biggest mistake as a doctor? The reason why I keep my doctor is, she said, I became a doctor. and that was the honest, she said, I never knew how much work this was gonna be. She said, I never understood. I just saw her 2 months ago and she said, you're getting fat, Sean. I said, well, you're getting shorter and I can lose weight. You know, that's the relationship. A doctor and a nurse are taking care of every part of you have to lay your life in the hands of these people. And some of these people are just as bigoted and ignorant. Just because you went to school doesn't make you intelligent. Some people can pass the test. You have to look, and if you don't like it, you have the right to tell. Every state in this country has these same rights. You have a right to choose your health care and the person that is taking care of you. And if you don't trust them with your life. Don't put your life in their hand, because they're making decisions on the medications that you get. If that person doesn't care, they're not going to take that extra step to make sure that you're okay. I was taught by this little Filipino woman, her name was Miss Chan. I almost quit nursing, and I'm just real quick. My mom told me if I didn't become a nurse, I had to get out. Okay. So I decided at that time, I love eating and I like staying at home. So I'm gonna go become a nurse. My sister attests to this. I became a nurse. My mom hung up the phone. She said, you ain't a nurse yet. Don't talk to me. Don't talk to me. That's a whole different conversation. But what this little Filipino woman taught me, and that is lost in the profession, is every person has a right to dignity. Every person has a right to be treated like they're your family. And I guarantee you don't get that from every nurse. And that's a problem. It is a true problem.
Not that I ever interrupt my brother. I have only about 3 minutes before I have to go. The other health disparity that I wanted to highlight is that of women. Most of the drugs are tested on men. And if you know anything about a woman's body, you know that it changes every 10 years. If you're over 40, you know that better than anybody, okay? Every 10 years, your body is different than it was at 20, 30, 50, 70. A lot of that has to do with the change in your body composition in terms of water. What my biggest advice to anyone is to never go to the hospital alone, okay? And the reason why is because you need somebody to emotionally support you as well as witness what you see. I've seen it many times. Someone will come into the hospital and they will be, it's not blacklisted, it's just termed difficult. You know, I already gave them so-and-so medicine and they're still complaining. Well, they're complaining because it didn't work, okay? And so the thing is that it's always better to have someone advocate for you than you advocating for yourself. So if you ever have to go to the hospital, I don't care how grown you think you are, you go and take somebody with you. And then that person can, if all they do is just sit beside you, I'll tell you the truth. There have been times where me and my brother, both of us have went to the hospital. They always speak to him like I'm not even there. Like I'm not even there, really? Okay, I'm talking about my specialty. You still speaking to him? He's a pediatric nurse, really? So that's my biggest advice to women and anyone who goes into the hospital. It's a different world. We speak a different language. Find someone you can speak to, somebody you can connect with. And if that doesn't work, find a different care system.
Hey,
I gotta
before
go, people.
All right, Sonia.
You guys have a good evening. Bye-bye.
Thank you,
Bye-bye.
Sonia.
Thank you.
Okay,
Hey, Sean, I
bye-bye.
was wondering before you go, there's about 13 high school students on here. Is there any message you have for the high school students before we sign off?
I will say this to the kids. You don't have to be a doctor. We need nurses. We need ultrasound techs. These jobs pay really good money. You don't, I say go to school, research it. Hey, look, my cousins, if these are the kids that are with my cousin Lynn, please ask. I will, ultrasound techs. Now this is California wages. RNs make about, in California, $190,000 a year. Ultrasound techs with overtime and the way they work, they're making close to $200,000 a year. The X-ray techs are making close to $150,000 a year. There's a lot of money in it, and you can have a very good life. You don't have to be in high tech to help. We need African Americans. We need Latinos. We need people of every shape, color, and form in the healthcare industry. The way we change it is from the inside. You can yell and scream from the outside. All they're going to do is pay you off and try to get rid of you. But if you guys want a career that will fulfill you, I will say this. I prefer to cook for my life. I love to cook, and my family will tell you I can get down on some barbecue. But I'm a damn good nurse. And I look out for my patients, and it is taking care of my sons. My sons are, this is one of the most expensive places to live in the damn world, excuse my language, but it does make, there are great careers. Right now in Santa Clara County, we have nobody that can do EEGs. That is where they put probes around your head and they analyze your brain waves for seizures and to see if you have brain function. Our county pays for somebody to come in, just for them to walk into the door, they get $500. That's not including the $150 an hour that they get paid. We don't have anybody that can do that job anymore. I'm just saying that the healthcare field, you don't have to be a nurse. You don't have to be a doctor. There's plenty of jobs that you can do. And you don't have to be a janitor. You can be, there's so many jobs that are needed that African Americans and Latinos can fill. And you guys can have a wonderful life and have a fulfilling and fulfill your soul because you're helping somebody.
Thanks, Sean. And thanks, I'm really happy that so many students of Lynn's have joined us tonight. I really appreciate it. So it's 8 o'clock and I do want to be mindful of people's time. I really appreciate everybody participating today. Like I had said, I'm going to post this video later and also include some of the links to some of the resources. So if people are interested, you can check out the book, you can check out ways that you can get involved. I want to wish everybody a healthy holiday season, whatever holiday you celebrate. Stay safe. And we'll pick it up in 2022, and we're going to have some really exciting things, community action events that we're going to be doing in 2022. And I'm looking forward to participating with everybody next year. So with that, I'll say thank you and have a good night.
Thank you,
Chris.
Jenny. Thank
Thank
you, Sean.
you.
Thanks,
Thank-
Sean.
Happy holidays.
Yeah.
Great
happy holidays.
discussion. Good night.
Thanks. Good night.
Good night.
Thanks, Lynn.
Thank you, Jenny.
Mhm.